ADA and disability awareness, and specifically as the ADA applies in disasters and in shelters. Let's go to the next slide, please. This is a standard disclaimer, just saying, please only use this information for yourself. I know you will be sent the slides, but please don't use it in another training or send it on to other folks. The reason is that we want to make sure that when people use our materials that they are still up to date. And so if you do need to use it at some point in the future, just ask us and we'll be happy to talk to you about that. Okay, next slide. This is how you would contact the Pacific ADA Center if any of you has any questions at any point. We have a toll-free number, which is 1-800-949-4232. That's actually the same number for all of the ADA centers across the country because we are an ADA national network. And we serve at the Pacific ADA Center, Arizona, California, Nevada, Hawaii, and the Pacific Basin. So feel free to call that number. Our email is also on this slide, ADA Tech, that's ADATECH at adapacific.org, and then our website at adapacific.org. We think you will find really helpful, and we also have a specific emergency preparedness and management page on that website that you might find helpful. Next slide. Let's talk a little bit about disability awareness and etiquette so that when you encounter people with disabilities in the shelter, you know a little bit about that. Next slide. This is a quote that I like about diversity. Diversity and inclusion are about giving value to every human being, no matter our differences. So people with disabilities are often different than those without disabilities, but it's all about diversity in the world, and everyone has value. So I like to throw this quote out every now and then. Next slide. Disability demographics. So how many people with disabilities are there in the United States? Next slide. Actually, it's 41 million people, and that's 12.7% of the US population. And that's a statistic from the US Census Bureau. So it is quite a large number of people with disabilities. Next slide. And because there are a large number of people with disabilities, there are also many types of disabilities and people with disabilities. Next slide. There are disabilities that are visible, so you can actually see the disability. You might be able to see that the person is using a mobility device, or in this case, it's a skier with one leg using outrigger skis. And then in the other slide, the other picture, you see another skier who is actually just on skis and poles, but she is actually someone who has low vision. And so her disability is invisible. So it might be a visible disability, it might be an invisible disability. Next slide. It might be a temporary impairment, which may or may not be a disability. It depends on how long the impairment might go and how significant of an impairment it is. If it's a broken leg that's going to last a very short time, then it may not rise to the level of a disability under the ADA. But if that leg might continue to have problems and cause mobility difficulties for that person over time, then it indeed might be a disability. And of course, having an amputation would be considered a permanent disability. Next slide. So what about invisible disabilities? As I said earlier, not everyone has an obvious disability. 74% of people with quote unquote severe disabilities do not use an assistive device of any kind. So they don't use a wheelchair, they don't use crutches, they don't use a white cane. So you don't necessarily know that they have a disability. And people with invisible disabilities often face more discrimination than people with apparent or obvious disabilities. Do you know why? And you can put that in the chat if you wish, or
In the meantime, while we're waiting for some answers in the chat, Jan Scott is asking that can he use this information specifically for Idaho, Montana, but for Red Cross use? Is that okay? The specific slide right now.
Oh, this specific one? Yeah, that's fine. You can use it as long as it's, specifically for Red Cross. And then if you're going to use it, way into the future, if you could let us know, that would be really helpful.
Thank you, Jan. So we have an answer in the chat. Says, do they think that they don't have disabilities if it's not visible?
Right. Let's go to the next slide. That and this is examples of invisible disabilities, but people often think that people with invisible disabilities are faking it. They think they're faking their disability. And so they often face actually a greater level of discrimination than people that have really obvious or visible disabilities. And there are many, many kinds of invisible disabilities. There's learning disabilities, epilepsy, chronic pain, diabetes, depression, arthritis, all kinds of different disabilities that are not seen, but are actually considered disabilities under the ADA. And we're going to talk about the definition of disability in a moment. Next slide. A little bit about disability awareness and language. There are some terms to avoid and some terms that we like to tell people to use. So we ask that people avoid terms like crippled or handicapped or quote unquote the disabled, kind of grouping people in a monolith as the disabled. We would prefer that people use person with a disability or disabled person, or of course, if you know someone's name, you should call them by their name rather than just as a disabled person. Also, we prefer that people not use the term wheelchair bound, but person who uses a wheelchair or a wheelchair user, because most people who use wheelchairs do not feel bound to their chair. They can get out and move around, and at least scoot around and move in and out of their chair. So wheelchair bound is a term that we discourage people from using. Next slide. We also discourage people from using terms like deaf and dumb, which is kind of an old way of referring to somebody who might be deaf and does not speak, does not voice for themselves. And we try not to use any time that suffers a hearing loss or suffers a mental health disability, any kind of victim or suffering language. We tell people that that's actually not so great to use because it does make a person with a disability feel like they're victims and feel like they're suffering, and they may not be suffering. They simply have a disability. So saying it's a person who is deaf or a person with a hearing impairment or a person who is hard of hearing maybe might be an acceptable response if a person is not completely deaf. Also saying that somebody is deformed, lame, cripple, or an invalid. And another way of pronouncing invalid is invalid, right? So you don't want to use that terminology when you are talking about somebody with a disability. Instead, talk about a person with a physical disability. And then, it's actually kind of hard for me to see the bottom part of this slide underneath the controls here. Iway, can you see what the last part of this says?
Yes, it says mentally defective, slow, or retarded.
Right. So don't use the term retarded or any kind of term like defective or slow. Instead, say maybe a person with an intellectual disability or a person with a learning disability. So these are all kind of examples of language that are language that's good to use and language that is maybe not so good to use. Next slide. And this is a slide where there's several pictures of people in wheelchairs doing very active things on the beach, doing a skateboard run at a park, going down the sidewalk, getting ready to go shop somewhere. So Don't use the term wheelchair bound. Instead, a wheelchair can actually be a liberating device because it can help people be out in the world and doing what they want to do. So that's one of the reasons why we say don't use wheelchair bound, because it can actually be a device that is freeing for some people. Next slide. In disability etiquette, one of the first things we talk to people about is ask the person first. Never assume that someone with a disability needs help to do something, and never assume that you actually know how to help them. The best thing is to ask someone who looks like they may need assistance, may I help you or may I assist you? And it could be that they are trying to open a door. It could be that they are trying to get something out of a bag. So first you say, may I help you or may I assist you? And then if they say yes, then you say, how? How may I help you? How may I assist you? If they want assistance, the person will be happy to tell you how to provide it. If the person does not want assistance, don't be offended by that. It could be that the person just says no, and it could even be that they say no in a very unkind or rude way, but don't worry about that. You have done the right thing by asking if they need assistance, and if they say no, just say, okay, that's fine, and let them go about their business. Next slide. In communication for disability etiquette, we have a few things that we suggest. Always speak to the person who is deaf, not to the sign language interpreter who might be there. Remember, the interpreter is there to facilitate the communication. So don't turn to the interpreter and say, would she like to know how to get to the meal area of the shelter? Turn to the person who is deaf and say, would you like to know how to get to the meal area of the shelter? And the interpreter will interpret that for you. Always make eye contact with wheelchair users. Try to get down to eye level by finding a chair or a bench to sit on, but don't kneel down for a really long time, because that's going to make you uncomfortable and it's going to make you look uncomfortable to the person that's in the wheelchair. But when you can, try to get down to eye level. Also, when you talk to blind people, also make eye contact. Even if they can't see that you're doing that, they can tell where your voice is going, and that is the important thing. And making sure that also that if you leave a room and you've been talking to someone who's blind, say, I have to leave the room for a moment to go get some paperwork or to go get something, I'll be right back. And that way they know, so they don't continue talking to you after you've left. Next slide. Greeting people. You can ask, again, using the rule of thumb of always ask first. Ask how the person prefers to be greeted, if the person has no hands or if they cannot move their hands. Some people are fine with a touch on the arm or the shoulder. Others may not want to be touched at all. So it's really important that you ask them. That normally if you shake hands with somebody, you can say, normally I shake hands when I greet someone for the first time. I don't really know how to greet you because I can't shake your hand. And then the person will tell you. If they're using a prosthetic arm and a hook, they might offer you that, and definitely take that and shake it if they offer you that, because that is the hand that they are offering you to shake. So don't be afraid to shake their hand if it's a hook or if it's a differently formed hand. And then also listen to them if they tell you, this is how I prefer to be greeted. Next slide. Also, it's important to speak normally. Have normal conversations and don't be afraid to say the wrong thing. It's fine to say to somebody who uses a wheelchair, would you like to go for a walk? Or could you ask Jenny and Jenny is a person who uses a wheelchair, could you ask Jenny to run over and ask the boss what time the meeting starts? Well, Jenny's not going to run over there, but she can wheel over there. And it's fine to use just normal words and normal phrases. Don't be afraid to say the wrong thing. You can say to a blind person, did you see the movie last week? It's fine to use normal language. Next slide. So things to avoid. Don't speak extra loudly to people with disabilities unless you're asked to do so. Most people with disabilities are not hard of hearing, and it doesn't help them if you speak extra loudly to them. If they want you to speak up, they'll tell you. Also, please don't lean or hang something from someone's wheelchair push handle or their armrest or something. Don't hang your dry cleaning on someone's wheelchair. In other words, if you're on a bus with them. That wheelchair is part of their personal space. So remember that you should not be invading their personal space. Also, never remove someone's mobility device or their white cane. Like, for example, if somebody transfers to a seat in an auditorium or in a meeting space, don't just take their wheelchair or take their white cane and move it. Ask them first if you can move it, and then tell them where you're putting it. Because if that space is ever evacuated, and you know this for being emergency management and disaster professionals, if that space has to be evacuated and you have put their mobility device away and you have to leave the premises before they do, they need to tell someone else where that mobility device is. So it's important that you tell them. Also, never push or pull someone across the street. Again, ask them, do you need any assistance in crossing the street? And then if they say yes, then say, how may I assist you in getting across the street? Never just grab someone's wheelchair or grab someone who's blind by the arm and walk them across the street. It may not be where they're going, and they don't know who you are or what your intentions are. Next slide. Some important skills. If you get a call, a telephone call, know what a relay call sounds like. The relay service is something that exists across the country, and it's where operators use the service to communicate with a person who is deaf or who has a speech disability on the other end. And then that operator will then call a hearing person and relay the conversation between the deaf person and the hearing person, or the person with a speech disability and the other person. So when the call comes in, they will say, this is relay operator number 1811. Have you taken a relay call before? That is not a robocall. That is not a bad call. That is a relay call. And you can say, no, I haven't taken a relay call before, and they will explain to you how it works. The bottom line is it's just like any other conversation. It's just that when you're finished talking, you say, go ahead, and then the other person knows that they can talk. And so you go back and forth in that way. Also, you may want to learn how to use the sighted guide technique to give someone who has a vision disability or who's blind navigation assistance, particularly if they're arriving at a shelter, they're not familiar with the shelter, and they may need to have a sighted guide to guide them around to get them used to where things are in the shelter at first. They may want to place their hand on your elbow or on your shoulder. So when they do that, ask where they would like to place their hand, and then verbalize the route as you're going past things. So say, this is where the men's restroom is. This is where the meal area is. This is where the sleeping area is. So verbalize the route as you're going through so that they can get oriented as much as possible. Also, make sure you tell the person if you're going up or downstairs or if you're going through a doorway so that they know to kind of come behind you and they know to grasp the stair rail to go up or downstairs. Next slide. The key to disability etiquette, as I've said a few times, is just ask. Ask the person how to help them and then ask how to help them. Next slide. Any questions about disability etiquette before we move on to the ADA and the ADA definition of disability?
You're able to type in the chat if you have any questions. Okay, Eileen, I'm going to unmute you. Just give me 1 second. Go ahead, Eileen. You can unmute yourself. Eileen, you're able to unmute yourself?
Well, maybe Eileen's microphone doesn't work. Eileen, can you type in the chat or?
Okay, Eileen, we'll go ahead and save this. If you can type in the chat, type in the chat. Otherwise, we'll come back to you towards the end. Jen, let's move forward for now.
Okay, yeah, and there will be a couple of other opportunities for questions, so you can ask your question later if you wish. Next slide. Let's talk a little bit about the ADA in an overview way, and then talk about some specifics that could apply when you're in a shelter situation. Next slide. The Americans with Disabilities Act has 5 titles. Title I is employment. Title II is public entities, that's state or local government entities. And Part A is state and local government. Part B is public transportation of Title II. Title III is public accommodations, and the Red Cross is typically considered a public accommodation, and a shelter would be a public accommodation, even though the shelter building may often be owned by a public entity, a state or local government. When it's open to the public and the Red Cross is operating it, it becomes a place of public accommodation. Then ADA has Title IV, which talks about telecommunications, and that includes the relay service that I talked about earlier. And Title V is miscellaneous, that also includes information about how to enforce the ADA and the fact that you cannot retaliate against someone for asserting their rights under the ADA. It's important to understand also that the ADA is a civil rights act. So a violation of the ADA is a violation of someone's civil rights that falls under the ADA. Next slide. The definition of disability under the ADA overall has 3 sections, or what we call prongs. The first section is a physical or mental impairment that substantially limits one or more major life activities. And we're going to talk a little bit more about what substantially limits means and what major life activities mean. The duration of the impairment, in other words, how long the impairment lasts, is usually greater than 6 months, but may not always be. It could be that, an impairment that lasts a little longer is not a disability. It could be an impairment that is a little shorter, might be actually a disability. So it's kind of hard to say in terms of an actual time frame. And you also do not consider the presence of mitigating measures. And we'll talk about what mitigating measures are more in a moment, but that's to say that you do not consider medication or someone's prostheses or something like that when you're trying to determine if they fit under this first section of the ADA definition of disability, if they have an impairment that substantially limits one or more major life activities. So you look at that without any mitigating measures. Someone could also have a disability if they have a record of an impairment. Maybe 5 years ago they had a heart attack and they had some surgery to put a stent in, and now they are perfectly fine. They have no heart condition at all, but they may have a record of that impairment, and maybe someone like a future employer could use that record against them and discriminate against them by seeing that record of their impairment. And if they are discriminated against because of that, they fit under the ADA as a person with a disability. Also, in the third prong or section of the definition, they could be someone who is regarded as having an impairment. And that means it's somebody who's never actually had a physical or mental impairment, but maybe they have burn scars and someone assumes they have an impairment. Or maybe there's been a rumor floating around that they have an impairment, but they don't actually have one. And if that person is discriminated against because someone assumes, again, that they have an impairment, that person would fall under the definition of disability as well. It is also important to note that somebody who is associated with someone with a disability, for example, a parent or a child or even a friend or spouse of somebody with a disability, if they face discrimination because of that association with the person with a disability, they can also be covered by the ADA. Next slide. Major life activities, there are a lot of examples of these, but they can be things like thinking, concentrating, seeing and hearing, breathing, walking, standing, grasping, speaking, caring for yourself, learning, working. There's many, many examples of major life activities, and that first section or prong says you're substantially limited in one or more major life activities. Next slide. Also, the ADA says that major bodily functions equal major life activities. So if you have an impairment in a major bodily function, like your immune system, like normal cell growth for cancer, for example, like neurological system, your respiratory or circulatory system, your endocrine system, which people with diabetes can have, your digestive or bowel or bladder systems, any of those systems where you have a physical or mental impairment, that is considered a major life activity, and that makes you fall under the ADA definition of disability. Next slide. How do you know when a major life activity is substantially limited, like we talked about earlier? You would compare that major life activity with most people in the general population. So that means if it takes most people, say 15 minutes or so, 10 minutes to walk half a mile, but it takes somebody with a mobility impairment maybe 30 minutes to walk half a mile, then that person would be considered to have an impairment that is substantially limited, and they're substantially limited in the major life activity of walking. It should not require a lot of investigation to determine if somebody actually fits under the definition of disability. And in a shelter situation, they may simply be able to say, I have this disability. And remember, it could be an invisible disability. And then you need to find out, well, what can you do to assist them if they have this disability? And what can you do in the shelter situation to be able to meet their needs? Next slide. Also, we talked about mitigating measures. When you're looking to see if somebody has a disability, you do not look at the mitigating measure. So examples of mitigating measures can be medication, like I talked about earlier, medical equipment and devices, mobility type equipment, prosthetic limbs, hearing aids. Any of these things could be mitigating measures, and you do not look at the person's impairment when they are using the mitigating measure to determine if they have a disability. You look at when they are not using the mitigating measure to determine if they fall under the definition of disability. Next slide. Pregnancy is a disability, and we talked about this a couple of days ago. This is really confusing. It's kind of hard to know what this is. Pregnancy itself is not actually a disability, but there are conditions that can occur during pregnancy or maybe immediately after pregnancy that could be disabilities. So gestational diabetes can affect the endocrine system and therefore be a disability. There could also be conditions that impair circulation and substantially limit walking in women that are pregnant. Also, after women give birth, some women have postpartum depression, and that depression can be considered a disability under the ADA. So it is important to understand that pregnancy itself may not be a disability, but there are many different kinds of conditions associated with pregnancy that could be considered a disability. Also, it's important to note that when you talk about people with access and functional needs, or AFN, pregnant women are actually considered part of the AFN population, even if pregnancy itself may not be a disability. Next slide. It is also important to note that both the Department of Justice and the Department of Health and Human Services have determined that long COVID, if it substantially limits one or more major life activities, is now considered a disability. And those two agencies wrote a document that talks about how long COVID is a disability. And I've included a link to that in the resources in this presentation about the document that is co-written by the U.S. Department of Justice and the U.S. Department of Health and Human Services. Examples of major life activities that could be affected by long COVID are walking, breathing, thinking, and major bodily functions such as the respiratory and the immune system. All of those could be affected by long COVID and therefore could be something that affects or limits one or more major life activities. Next slide. Questions about the definition of disability?
Ali, you want to go first and included the question that you had earlier? Please tell me that you're able to unmute now. Someone tell me that you guys are able to unmute.
Can anyone unmute?
Yeah, we could unmute.
Testing,
I'm
testing.
unmuted.
Yeah,
We can unmute.
Oh, good.
Yep.
Good. Okay. Eileen, are you still there? Okay, we will read some of the questions in the chat.
Okay.
Rick is asking that, what if you live in a place that has nothing ADA compliant and total disregard for the law? What do you do?
Well, the ADA is a law and it is a civil rights law. The way it is enforced, I will explain. There's two ways to enforce the ADA. One is to make a complaint to one of the federal agencies that enforces it. That could be the U.S. Department of Justice. If it's an employment claim, it could be the Equal Employment Opportunity Commission. It could even be the U.S. Department of Health and Human Services if it's a healthcare related complaint around the ADA. So there are many federal agencies that enforce the ADA. If it's transportation, again, for example, it could be U.S. Department of Transportation. So you can contact any one of those agencies, their Office for Civil Rights. And I do have some information at the end in the resources for the U.S. Department of Justice. And even if it's a complaint that needs to go to another federal agency, if you make the complaint to the U.S. Department of Justice, they will make sure that it gets to the right agency for your complaint. The second way that you can enforce the ADA is by filing a private lawsuit. So those are the two ways that the ADA is enforced, and you can do both or you can do one or the other.
Thank you.
so much. So Eileen put in a comment earlier that she wanted to make sure that we know that when we speak with a deaf person, that the most important thing is facial actions. You know, even if you're wearing a mask, your eyebrows and your upper face can show the expressions.
Yeah, that's a great comment, great point. And I would say if it's possible, if you have any clear masks that actually meet, and I do believe there are some that meet the CDC definition of good masking, if there's any way you can wear clear masks, being able to show your mouth and as much facial expression and gesturing as you can, that will also help people who are deaf. So good point.
Thank you. I don't see any other hands. I don't see any other questions, so we can move forward.
Great. Next slide, please. Let's talk a little bit about the ADA requirements, including ADA requirements in shelters. Next slide. In general, the ADA says you cannot discriminate against people with disabilities. The overall thing to understand about the ADA is that it is trying to give people with disabilities who fit under the definition an equal opportunity to participate in and benefit from the programs, services, and activities that are provided by whatever entity is covered, whether it's Red Cross or the state or local government providing the building, whatever it is. The purpose of the ADA is to give people with disabilities an equal opportunity to participate in and benefit from those programs. Also, it's important to note that people with disabilities deserve to be in the most integrated setting possible. You should not have separate shelters for people with disabilities unless they have significant medical needs, in which case they may need to be in a hospital or other medical area. But a disability in and of itself is not a medical need, and as many shelters as possible should make sure that you take people with disabilities and that you do not segregate people with disabilities from the rest of the population. So it's important to understand that. Also, don't use eligibility criteria that may screen out people with disabilities when you're doing your programs. For example, if you tell people that they need to present identification, make sure that you're not requiring that it's a driver's license, because a lot of people with disabilities don't drive. So make sure that if you are requiring a photo ID, that it can be another kind of ID that's issued by a government entity. And then the last part of that, again, I can't see what it says because of the.
Sorry, it says no punishment for asserting ADA rights.
Oh, right. Yeah. So as I mentioned earlier, like in Title V of the ADA, you cannot retaliate against someone for asserting their rights under the ADA. Next slide. You must have physical accessibility as much as possible at the shelters. So you should provide physical accessibility at the entrance. If you have steps, there should be a ramp, hopefully, and a wide doorway for people to be able to come in. There should be a 36-inch wide accessible route throughout the shelter so that people using mobility devices can move around, including in the sleeping area, just at least one route so that people can get through to where they sleep and maybe where the restroom is, etc. There should be sleeping areas with clear aisles. There should be accessible toilet and shower rooms, and there should be accessible meal service areas. So this is just a few examples of areas where it should be accessible within the shelter. And I saw someone raise their hand. Does someone have a specific question about physical accessibility?
I didn't see a hand, but I do see a comment. Scott put in the comment, he said he thought all Red Cross Rent Shelter facilities must be ADA compliant and reviewed when we do the site survey. His question was, what about those partner run facilities that, do they also must meet the ADA requirements?
Well, they should, yes. If you're trying to offer shelter to people, I know it might end up being in a church. It might end up being in, we talked about like an Indian casino, other areas. But as much as possible, even if you're partnering with another organization, you should try to make that facility as compliant as possible. Okay.
Go to the next.
Yes. Something else that the ADA requires is reasonable modification of policy, practice, and procedure. A few examples of this that could occur in a shelter would be, for example, allowing shelter residents to store medication that needs refrigeration in shelter refrigerators. For example, insulin typically needs refrigeration if it's going to be more than a couple of days that the person has the bottle of insulin. So you may have a rule or a policy at the shelter that you don't allow shelter residents to use the refrigeration, but you need to modify that policy or that practice if somebody needs to store their medication there. Also, if someone has a personal care attendant that is not actually staying at the shelter, or maybe even another family member that is not staying at the shelter, but they need to come in and provide personal care to that person with a disability, even if you have a policy or a rule that says you don't allow people who are not staying at the shelter to come in, you must modify that policy to allow that person, if you know they are there to assist or provide care for someone who is in the shelter. So these are just a couple of examples of reasonable modifications. Next slide. You also, under the ADA, need to provide effective communication. And that is, you need to provide written and verbal communication to people who have vision, hearing, and speech disabilities that is as clear and understandable to people with these disabilities as it is for people without disabilities. So effective communication means the communication is as clear and understandable to people with disabilities as it is for people without disabilities. And there are several considerations for what we mean by effective communication. It depends on the nature of the communication, the length of it, the context, the complexity of the communication, and the individual's preferred method of communication that needs the effective communication, the individual with a disability. Next slide. So one way that you provide effective communication is through auxiliary aids and services. So for written materials, for example, you might provide alternative format in Braille, large print, or audio recording. I know a lot of shelters will put up flyers that give information about certain things that are happening. If you have people with low vision or who are blind at the shelter, you don't necessarily need to Braille all those flyers, but you need to make sure you are communicating the written information on those flyers to anybody who is blind or low vision that is at the shelters, because they're not going to be able to read them. So make sure you're communicating that information. And if you have pre-printed information, in advance, the more that you can provide that information in alternative formats, the better that is. Also, using American Sign Language interpreters. I realized during disasters that it may be difficult to get in-person American Sign Language interpreters, but you should try as much as possible and hopefully have contracts with people to provide interpreting services. Another possibility is having a contract with a video remote interpreting service where there's a remote interpreter that interprets through a tablet. But there are very specific rules for being able to use video remote interpreting, and I'm going to get to that slide in a moment. So it may be appropriate to use video remote interpreting, and it may not be, depending on the situation. Also, you may want to use real-time captioning if you're able to find a captioner that is available to do that. And again, you can do remote captioning as well, or you can text back and forth with someone if that's the only option that you have, because somebody may not use American Sign Language as their language. They may use English instead, and you need to communicate using texting or captioning. Also, you may need to have assistive listening devices at some of the shelters and determine how you can have those and be able to use those and make sure you have batteries and other things that are needed to maintain the assistive listening devices. You also could have qualified readers, people that are qualified to read important information in writing to somebody who is blind or low vision. Next slide. So as I said a moment ago, you may be able to use video remote interpreting at a shelter, but if it is chosen, it must meet all of the following performance standards in order for you to use it. And these are performance standards that the U.S. Department of Justice has said must be met. So you must use real-time, full motion video and audio over a dedicated high-speed, wide bandwidth video connection, or a wireless connection that delivers high-quality video images that do not produce lags or choppy or blurry or grainy images or irregular pauses in communication. So that's one thing that one performance standard that must be met is the full motion video and audio. You also must have a sharply defined image that is large enough to display the interpreter's face, arms, hands, and fingers, and the face, arms, hand, and fingers of the person using sign language, regardless of his or her body position. So like the person was saying earlier, it's really important that the face and the upper body and the arms and hands be visible in order to be able to really communicate effectively in sign language. And that's for the interpreter and the person who is deaf as well. You must also have a clear, audible transmission of voices, and you must have adequate staff training to ensure that you can quickly set up the remote video interpreting and that your staff are trained to properly operate it. And I would add to this is in advance, you need to have a contract with the remote video interpreting service so that you know actually how to set it up and which service you're connecting with so that you can operate it quickly in the event that someone needs it at a shelter. So all of these performance standards must be met before you can use video remote interpreting. Next slide. Okay, so we've kind of talked a little bit about what the ADA requirements are in a shelter, and there are many other requirements we could get into, but we have limited time. I also have given you some resources here. There's some basic things like our website again at the Pacific ADA Center, the ADA National Network website, and the U.S. Department of Justice website. And it does say on the U.S. Department of Justice website, in addition to the technical assistance materials and the regulations, it has an area where you can file a complaint with the U.S. Department of Justice And even if that complaint, as I said earlier, needs to go to a different agency, the Department of Justice will make sure that it gets to the right place. So I would use that website, ada.gov. Next slide. And then I included the resource on long COVID as a disability. That's by the U.S. Department of Justice and the U.S. Department of Health and Human Services. I also included the ADA checklist for emergency shelters. This gives you information about the physical layout and what physically needs to be accessible at an emergency shelter. So that's a checklist that you can use. And then I also gave you an effective communication document from the U.S. Department of Justice that goes over the general requirements for effective communication. Next slide. Okay, any questions about what I just went over or about any other parts of the presentation?
Yes, so we have a question. Georgia is asking, what constitutes a qualified reader?
Well, generally, and it has this information in the regulations, in the Title II and Title III regulations, but it is a person who can read, clearly and impartially. It has some very specific standards that I don't have in front of me right now, unfortunately, but it's definitely on ada.gov. If you go there and look for the regulations, either Title II or Title III, and you look for effective communication, you look for the definition of a qualified reader, you will see it there. It will have the definition of a qualified reader and it will tell you. But in a disaster situation, you may have to use people that are other than qualified readers, but you should make sure that you are reading everything to somebody, and that you are reading it as clearly as you can for them to understand what you're reading.